When we think about interoperability in healthcare, our minds immediately go to the exchange of data between providers and providers and patients. But there are many other players in the healthcare ecosystem that also require access to health information. I'm thinking specifically about payers. Payers and providers need to exchange a lot of data. But when we think about interoperability, we often don't think about those two parties getting together and moving information between them. Now, there's one company, MRO Corp, that's just come out with a slew of new modules and new products that cater to this payer-provider interface. So I wanted to find out more about these new modules. Hello and welcome to Healthcare IT Today, where we explore the latest trends and interesting technologies from the world of health IT. I'm Colin Hung, and I'm about to meet up with Matt Wildman, who is the Chief Commercial Officer at MRO Corp. I wanted to ask Matt about his new products and about what they're doing to make sure that the exchange of data between providers and payers is as smooth as possible. I hope you enjoy this conversation. Matt, welcome to the program.
Colin, so great to be with you. And before we jump in, let me just tell you, I've been a big fan of your content for quite a while. So it's really fun for me to be on the other side of this exchange.
Oh, well, thank you. Thank you for saying that. I really do appreciate it. Now, I'm really interested to talk to you about some of the new developments you have at MRO. But before we get there, can you tell us a little bit about the company and what your role there is?
Yeah, I'd love to. So at MRO, we've been on a multi-decade journey to accelerate clinical data exchange. We were founded in the release of information space about 20 years ago, and today we serve more than 900 hospitals, thousands of clinics across the country. And I think we've done a really nice job of injecting modern, innovative technology into a set of workflows that's historically been done in a very analog way. And perhaps more important than that, we've done so with an incredible service mindset. KLAS has recognized MRO as the category leader in this space more than 10 times. And in the mature market that we serve today, I think that's really hard to do once, let alone 10 times. So we're incredibly proud of that accomplishment, only really is measured by the fact that our clients are satisfied with the work that we're doing, which is incredibly important to us. So I joined MRO at the beginning of the year as our Chief Commercial Officer. It's a real treat for me to serve the teams that are doing the really hard work every day to do both kind of growing our impact across the country, but also providing that exceptional client service that our clients have come to expect.
Well, congratulations on that 10 times being on KLAS. That is not an easy task. So
thank you.
That's a testament to the service and to the products you provide. But as you talked about it, like you're right, a lot of what I wanted to ask you about today was around the automation that you're bringing to what was a very manual process, and specifically the communication or lack thereof between a provider and a payer around the clinical data. Are you seeing that same challenge? Is that kind of what your clients are telling you about, talking to you about?
Yeah, how much time do we have today? Look, I think that we are blessed to have a healthcare system that creates and delivers miracles every single day. The way that we are exchanging clinical information across the ecosystem, though, is fraught with inefficiency and error. And for us, it's a really fun problem to wake up every day and work on. Payers want more efficient, timely access to information. Meanwhile, providers are struggling under this massive administrative burden to keep pace with that ever-increasing growth and request demand from an increasing number of stakeholders across the board. So we have this fragmented system that creates a siloed network that I think makes true interoperability really evasive. And so I think we also have to own the fact that there's a trust divide between payers and providers that we have to own. Payers want access to as much clinical information as they can possibly get, and providers are hesitant to give up all of that information. So we have found the balance between providing payers the information that they need while just sharing the essential clinical data set that protects our patients' privacy. And at the end of the day, that's what we're focused on. Like elegant clinical data exchange creates an environment where both parties, the payers and the providers, have a holistic view of the clinical information they need to make great decisions.
So how is MRO addressing that challenge? Is there a particular product that you have, a service that you're providing
Yeah.
to really bring the payers and the providers closer together?
Yeah, we're doing quite a bit actually. We built an end-to-end solution that allows payers to ingest data from disparate records and clinical information sources, aggregate it, normalize it, and present it in the right way to support a variety of use cases. We call that our Payer Hub capability, and we built that in a way that allows us to ingest data for more than 250 EMRs today.
Wow. Okay.
That list will continue to grow. But we ingest that information, we aggregate it, we normalize it, and we present it in what we call a longitudinal care record, which is really important to go do. This EMR connectivity for these payers is a constant struggle because the list continues to grow and grow. We've been doing this work at scale for more than a decade. There's not an EMR that we've found that we can't connect to. And we've DAV certified our supplemental data feeds to create more efficiency in the process and trust in where that information is coming from.
So if I was a provider, Matt, and I was connecting into your payer hub, what would my experience be, or what would I see from your solution?
Yeah, it's actually got real applicability and value on both sides of the equation. So as a payer, take a payer for example, you have the ability to look at a member in a longitudinal way wherever they've been seen across the network. You can look them up, you can see where that care was provided in a very simple way. Of course, we're doing the work to, as we ingest that information, aggregate it for you so that it's presented in a very readable way. But if you want to go in and look at that full note that exists from whatever facility we pulled it from, that's available to you as well at the click of a button. The number of nodes on the network that we have connected over an extended period of time really allows us to create a richness of data that many payers don't have access to today. But then you flip that to the other side of the equation on the provider side, we'll provide them with that same longitudinal view of that patient. And we give them the tools to kind of see that information as that patient's coming into your facility or into your clinic for the day. But you can do other things with that too. You can actually create a pre-visit summary so that you could hand a provider his or her list of patients for the day, supplemented with recommended gap in care closure opportunities that we've aggregated based on having access to all of that information, and allow them to use that to manage their day in a more proactive way.
Nice.
So we're really trying to marry the connection between payers and providers, create real value on both sides of the equation, which is important as we work to minimize that abrasion that exists between the entities.
Yeah, I like how you're talking about it's not just one-sided. It's the benefits are it sounds very equal, and that providers can actually find good use out of your solution as well. Too often we hear about it sort of really benefiting the payers to the detriment of the providers. So it's really great that you're thinking about both sides.
Yeah.
Now, I know also earlier this year you introduced something called Payer Exchange, and we interviewed someone else from MRO earlier this year at HFMA, I think, to talk about it. But maybe for our audience, can you explain the difference between Payer Hub and Payer Exchange?
Yeah, I'm so glad you had an opportunity to spend some time with Mo. She's our Chief Product Officer. She's the best. And we're all really excited about kind of the innovation mindset that she's brought to the company and the pace and urgency through which she's driving kind of new roadmap developments for us. But what she talked to you about was our Payer Exchange product that we launched earlier this year. Payer Exchange and Payer Hub will operate together in a very complementary fashion. But the nuance is Payer Exchange is a fully digital capability that allows us to accelerate the release of information between provider and payer. And we think this has massive applicability for our provider clients who are struggling to keep pace with the seasonality that comes from their risk adjustment reviews, soon to be their HEDIS reviews. And with this fully digital Payer Exchange capability, we can automate that with negligible or no human intervention whatsoever. So the benefit to the payers is they get access to their information in days or a week versus weeks or a month. And for the providers, they have more intentional kind of oversight over their labor pool, which we all know is a big struggle today. But the way to think about them in concert is Payer Exchange is accelerating kind of the exchange of information across the ecosystem. But as payers have access to that information, Payer Hub becomes the visual medium through which you can view that aggregated data in a more meaningful way to kind of provide that picture of the patient or member's care journey.
Now, you were talking to me before, you have a very unique financial model for this as well. Can you tell me more about that?
Yeah, that's a really important distinction for us. And we believe that the HIM department should be viewed as a profit center, not a cost center. And so what we've committed to our partners is we will actually share in the revenue back with you that we derive from the request fulfillment of these various stakeholders. A portion of whatever we receive we'll share back with our provider partners, so that as we grow, they grow, vice versa. We think that makes for a great partnership.
So Matt, can you share some examples of how Payer Hub has really benefited providers and payers?
Yeah, of course. So while Payer Hub is a new name, the technology is not. We've been doing this work with organizations like Care First, Blue Cross and Blue Shield plans serving the DMV, DC, Maryland, and Virginia area. We've been doing work like this with them for years now. We've seen real benefit in terms of creating a much more efficient ingestion of clinical information by using our capabilities to do just that. We've seen a real improvement in the payer-provider dynamics in the areas of treatment, payment, and operations, which is really important, as we've discussed. But I think most importantly, we've seen measurable, meaningful improvements to the care of their population. So in our platform today, we're approaching 1.5 million members that are seen by Care First providers with this platform. And as we measure the success of that work relative to their members that aren't, we've seen double and triple digit improvement in the areas of HbA1c, blood pressure management, diabetes management, immunization compliance. And that, at the end of the day, is the mission we serve. We serve this mission of leveraging our robust network to provide better access to information and create this cockpit of sorts that both payers and provider networks alike can view real-time, up-to-date, complete information to go make more holistic care decisions for their population.
Matt, can you give us a little preview of what's next for Payer Hub? What are some of the enhancements that you guys are working on?
Yeah, I mentioned I started at MRO at the beginning of the year, and one of the things that I've loved most about this company is this collective disdain for the status quo. It's pervasive across the company. So our ambitions are high. We're moving at pace to go deliver accelerated roadmap innovation across our entire product portfolio, but specifically around Payer Hub. What you can expect from us, we're in the process now of building out a bidirectional care gap kind of information flow back to the point of care for our providers, informed by the data that we have access to, but giving them real-time insights as they're seeing their patients to potentially take more proactive steps. And we have to be really smart about how we do that work, because anybody can create a pop-up embedded in an EMR workflow. And all too often what we've seen is alert fatigue. They're not relevant, they're not meaningful. And so we're taking the time to do it right and be very thoughtful about it, so that when we do push insights to that point of care, it is relevant and it's highly actionable. So you can expect to see that from us very soon. And I promise you there's quite a bit of other work that we're doing, and I'd love to come back and share more about that with you in the future.
And we would love to have you back on the program, Matt. But before we go, where can people go to find more information about Payer Hub, Payer Exchange, and MRO in general?
Yeah, come to our website, mrocore.com, mrocorp.com. We'd love to have you reach out to us, and we'd love to share more.
Matt, thank you so much for being on the program today. Really appreciate it.
Thanks, Colin. Good to be with you.
Hey, I want to thank Matt for coming on camera with me and giving us that great overview of Payer Exchange and Payer Hub, and for really educating me on the complexities of payer-provider data exchange. And if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareittoday.com, where you're going to find a lot of great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.